Greetings. I'm Jean Williams and I'm talking about Barcaldin's 60 and Better program and its value in promoting quality of life for an aged population in a small remote community and the importance of volunteers to such groups and throughout the community. I work for Barcaldin Regional Council as coordinator of the 60 and Better program, a healthy ageing initiative originally designed by the Community Development Branch of Queensland Health. The 60 and Better program is centred on Barcaldin and aims to maintain physical and social well-being through provision of exercise classes, tai chi, croquet, social activities such as morning teas, craft mornings, hoi and bingo, health talks with health professionals and service providers, digital learning for older Australians and outings to other towns or groups. A monthly newsletter containing health information, community news, recipes, jokes, puzzles and calendars is produced and distributed by the coordinator and program participants. I am also an administration assistant with Barcaldin Community Care Services, that is Home Assist Secure, Commonwealth Home Support Program, in-home care and home modifications. The community care programs cover 5 towns of Barcaldin Regional Council area, approximately 54,000 square kilometres, and the home modifications scheme covers 9 local government areas in the central west of Queensland. Barcaldin, along with the other towns in these areas, is considered to be very remote, with a modified Monash model score of 7, and an Australian Bureau of Statistics Australian Statistical Geographic rating of RA5. These measures indicate the small size of the towns and distance from major centres. It is local government that is responsible for most services in these areas. Apart from paid work, like many others, I volunteer with a number of groups. Currently, I deliver meals for Meals on Wheels. I'm a member of Barcaldin Aged Care Incorporated, Barcaldin Cancer Volunteer Group, the Barcaldin Pastoral Agricultural and Horticultural Association and the Barcaldin Women's Show Auxiliary, the Barcaldin Golf Club and Barcaldin Men's Shed. Involvement with these groups gives me a sense of purpose and satisfaction in being part of the community as I age. It is the connections between groups and members which create a network that is part of the fabric of small community life. It is the small, everyday actions that bond and shape. Unfortunately, not everyone has a sense of community or a desire to participate. To age in place and participate in community life, contributing to the overall input and capacity using resources available to not only younger people is an ambition that enables older people to flourish. By accepting that we all can add something to community life because of different perspectives and needs means that we can hopefully develop an age-friendly community. Having sufficient services, including shopping facilities, medical treatment and support that meets the needs and expectations of older people, can determine whether they stay or move to a larger centre. Davis and Bartlett, 2008, contend that older people with the least resources are most likely to remain, but this does not account for the people who migrate in later years to live in country towns. The use of a service is a source of social activity and a means of social connection. There are those who rely on neighbours or family rather than have a service help. A variety of concepts relating to quality of life in older age, successful ageing, active ageing, productive ageing, robust ageing, ageing well, and healthy ageing have been advanced in response to changes in demographics. Common themes relating to independence, sense of control, choice in decision making, high levels of functioning, psychological well-being, physical self-reliance and self-rated good health are identified as among the components of living purposeful, meaningful lives. Participation in social and cultural growth and building sustainable communities can be attributed to many older people. In 2015, the World Health Organization defined healthy aging as the process of developing and maintaining functional ability that enables well-being in older age. Functional ability is the combined physical and mental capacity of an individual interacting with the environments they inhabit. These attributes enable people to be and to do what they have reason to value. The environments can enable or prevent or limit older people doing the things they feel are important. Some people reach older age with greater functional ability than others who have had fewer opportunities to develop resources and skills. For people living in rural and remote areas, there can be different sets of enablers and barriers. While aging in a small remote community is a choice some people have made based on lifestyle options, for others, aging in a place where they have lived for a large part, if not all of their life, is the norm. Staying in familiar surrounds where there are social and service networks and a sense of connectedness gives people a feeling of belonging. Ease of access to shops, little traffic to negotiate, low crime rates, opportunities for participation in community groups, and availability of digital technology, good supply of artesian water are reasons people choose to live here. Most public facilities are air-conditioned and have ramps where needed to enable people of all ages and mobility levels to enter and exit without difficulty. Medical, allied and dental health services, including telehealth and rural flying doctor service evacuations of serious cases, provide a semblance of what is required to maintain biomedically healthy communities. The paucity of mental health services means not always having the necessary appropriate support across the community. Older people often volunteer, and it is their commitment that adds a care factor, but also indicates that welfare responsibilities are being pushed onto willing bodies that become obligated to provide assistance rather than choosing to. These are the people who provide transport or cater for events and generally ensure their peers are safe. That ageing can also incur chronic illness and disability means that independence and ability to participate can be compromised. The social connectivity is modified and different relationships may be formed. The stoicism and resilience of many older people incorporate strengths and vulnerabilities and allow people with age-related disability or challenging circumstances to accept the situation. Financial costs are always a concern, and people reduce social activity to pay bills. The cost of electricity is a burden, especially in summer when an air conditioner runs most days. For those who do not have cooling, the high temperatures can lead to dehydration, heat stress and more serious conditions. This can compromise participation in group activities, even if it is in air-conditioned, easily accessed buildings. Studies have demonstrated a link between social participation and health, with poorer outcomes being reported for people who are geographically isolated and with limited access to health and social services. Engaging with community can increase well-being and lead to reduced loads on existing services, as older people are less likely to utilise health services. The Queensland Government Statisticians Office 2018 estimated Barcaldine Regional Council area had 2,869 residents in its 5 towns and on rural properties. 17.9% of the population is aged 65 years or older. Of Barcaldine Township's population of 1,422, 19.7% is over 65. Thus, there is a sizable proportion of the population who could be active contributors to the organisations and groups in the town. A significant number of older people do volunteer and keep organisations operating, but as the ages of the workers increase and the numbers of active members decrease, more groups are forced to amalgamate or close their doors. The mission statement of the Barcaldine 60 and Better program, which is funded by Queensland Department of Communities, Disability Services and Seniors and auspiced by Barcaldine Regional Council, is to enable older people at community level to participate in decisions and activities which affect their health and well-being. The coordinator, in conjunction with a committee of participants, determines the events and activities to be undertaken. The Human Standards Quality Framework is used to assess and promote improvement in provision of human services. Quarterly reporting to the Department, both qualitative and quantitative, about provision of community support and information, advice and referral is mandatory. Reporting provides an indication that service obligations are being met, but does not reflect the well-being of the participants and the program's health. The 60 and Better program is aimed. There is a need for service providers and community groups to further develop working relationships and joint events and activities where clients, members, participants are able to join in without the us and them demarcation. Joint ventures can provide mutual benefits and be whole of older community events and present old age and older people in a positive light. Intergenerational activities also help develop links with groups such as Girl Guides or schools, and younger people and older people are able to appreciate and learn other skills. Barcaldine 60 and Better program and Men's Shed are trying to improve outcomes for older people, including reducing social isolation and keeping connections with community through involvement in activities, and both receive Barcaldine Regional Council support, so closer ties could lead to more joint ventures and sharing of resources. The number of older people is increasing as a proportion of the population, even though the population total is in decline. So, older people make up a significant part of the community. They spend money across the community, provide hours of voluntary service in many areas by acting as carers for old and young family members, delivering Meals on Wheels, providing transport, performing the committee work in community groups, as well as being a reliable source of help whenever needed. The contribution of the older sector needs to be recognised as a finite resource, without which the community life as we know it will not continue. Because the ages of participants potentially spans 40 years, providing different activities aimed at different interests is a challenge. Being a service provider with community development origins, where a community worker and community members decide the direction and activities within guidelines of the 60 and Better program. Activities and events were and still are aimed at helping participants to succeed in their chosen endeavours. Whether mastering basic use of a computer or learning about using the internet, or undertaking a cooking class and learning the nutritional values of our favourite foods, or waving in the hands in the clouds in a Tai Chi session, reminiscing over a cuppa, participants are able to make their own choices. By encouraging resourcefulness and developing skills and maintaining confidence, participants are able to continue the roles they fulfil and possibly help others to gain more skills. To sustain current practices means input from other people. The program has been in existence here for 25 years. So, in that time there has been an evolution of preferred activities and participant interests and commitment to community events, as well as a continuum of personalities through the doors. A commitment from younger, older, aged people is necessary for the program to be viable. As the program relies on state government funding and Barcaldine Regional Council assurance as auspice, The future of Barcaldine 60 and Better program is not necessarily guaranteed after 2021 when the service agreement ends. No organisation can meet every whim. Where a need or request cannot be met, there are other avenues for people to be directed to. The 60 and Better program probably does not suit a lot of people who find it too structured or not providing the stimulus they need. Of course, there are people who do not want to acknowledge they may be eligible to attend functions because of their age. Being predominantly attended by women, especially since the formation of a men's shed, the program committee needs to examine its practices and analyse its future directions. More groups are forced to amalgamate or close their doors.